that, it'd be easiest to start with a mid-sagittal view of the brain stem. With the midbrain, anterior, middle, and posterior hindbrains, and the cervical segments. With dorsal root ganglia for each of these spinal segments except for C1, and with ganglia that we'll come to as we need them for posterior hindbrain, middle hindbrain, anterior hindbrain, and a funny one in the midbrain, which we'll come to in a moment. Let's consider the small fiber system. Small cells, T-shaped neurons, coming out to 3 nerve nets for pain, coming in through dorsal roots, branching, and I forgot to give you the name of this tract last time, and that's Lissauer's tract. Primary sensory neurons, first branching, they run 1 or 2 or 3 segments rostrocaudally, give off secondary collaterals into the deeper gray matter, which is the association plate for this system. And you'll recall from the typical spinal segment that we have a laminated nucleus. These fibers coming in, branching in Lissauer's tract, secondary collaterals given off to laminated nucleus. 3 elements, marginalis, latinos, proprius, the last of which gives rise to connections to motor plate and ascending sensory suprasegmental tracts. This system is present in every segment, and they obviously overlap in Lissauer's tract as they run rostrocaudally, giving off first primary and then secondary collaterals. And this holds true for every segment up through C2, where we have exactly the same pattern with these overlapping primary sensory neurons in Lissauer's tract. The same basic pattern holds for the head. The ganglion is the semilunar ganglion with 3 divisions, first, second, and third division of the trigeminal. Small fibers, small cells in Gaussian ganglion come in through the anterior hindbrain, branch rostrocaudally, but it's the caudal branch that comes down, a very elongated branch coming down through middle posterior hindbrain into C1, even into C2 for the first division of trigeminal, and secondary collaterals given off to the nucleus underlying it, which is exactly the same organization in the brain stem, with 3 components. And so we have this, between second division comes in to the same thing, not quite so far. Third division comes in, same thing, runs more dorsally and caudally not quite so far. So we have the pain temperature system for the face and its descending tract or spinal tract of the trigeminal. The caudal third of which is organized exactly like the spinal segmental apparatus. Now, where these overlap in C1, particularly, Lissauer's tract and the gray matter underneath it are very large. So if they stand out in any cross-section that you look at, just for C1, it would be several times bigger than I've drawn it here. It turns out that all of the pain temperature fibers for all of the other brainstem segments do exactly the same thing. So that when we see small fibers in the middle hindbrain segment, they'll come in and join, and with the posterior hindbrain, they'll come in and join the trigeminal tract. So we have this one big system throughout the whole spinal cord, brain stem, concentrated in descending spinal tract of trigeminal, Lissauer's tract, and the underlying laminated nucleus of descending tract or of the posterior horn. Any questions at this point? Now, one of the major functions of this system, as we said last week, was for flexor withdrawal, the pain, with this laminated nucleus projecting down onto flexor motor neurons. That go out to the flexor muscles. And so we have, if I put the cell body in, we have a polysynaptic reflex responding to pain, multiple synapses here in the dorsal gray, to flexor motor neurons for withdrawal from the painful stimulus. Now, if you look at this electrically, I'm recording from flexor muscles, and you have your sweep synchronized to record this. You stimulate, and after a latent period, allowing for these polysynaptic connections, you begin to get polysynaptic response, which looks like what? Clinically visible. Not very much. It's a little tiny twitch, so-called flexor twitch. And it's not until you increase the stimulus enough to get a withdrawal reflex that this builds up into a very prolonged withdrawal of that extremity or segments, whichever one you're talking about. And this now is a flexor withdrawal. Reflex. It obviously requires a lot of segments to withdraw the whole extremity. So somewhere between essentially one segment with a little flexor twitch and a multisynaptic, multisegmental, multisynaptic also, massive flexor withdrawal, you have all gradations of what kind of a response you got, what kind of response the individual gives you to the painful stimulus. Any questions on this? Okay, let's consider the next piece of the sensory plate, the large fiber system. Here we have, in cervical segments, for example, a large afferent going out to a spindle, muscle spindle, afferent, coming in the posterior columns, branching rostral caudally in that segment. And if this is a cervical segment from one of the spindles and one of the arm muscles, we have descending collateral going down, and secondary collateral is given off the Clark's nucleus, and an ascending branch coming up to the accessory or lateral cuneate nucleus, as well as intra-segmental connections which will make monosynaptic connections to the anterior horn cell related to this particular input. And so we have a basis for a segmental stretch reflex, whether it's flexor or extensor muscle, irrelevant, and projection to cerebellum through these second order neurons, Clark's nucleus, or the accessory cuneate. Any problems in this system so far? In the brain stem, we don't know much about this system. The one piece of the system that we know about has to do with the mesencephalic nucleus of the trigeminal, whose primary cell bodies lie up here in the mesencephalic nucleus, next to the aqueduct. T-shaped elements whose fibers go out to spindles in jaw muscles, whose intra-segmental connection is to motor neurons, they go out to the jaw muscles. And so, with the exception of the peculiar location within the central nervous system, we have exactly the same setup for tapping the chin and evoking a jaw reflex, from stretching spindles and jaw muscles to establishing a monosynaptic reflex connection to jaw muscle and return to where you were before you tapped it. We know a little bit more about the system than that. There are in extraocular muscles spindles whose cells also appear to lie in the mesencephalic trigeminal, coming in through the first division of the trigeminal. These, of course, go out through the third division, and connections to various motor neurons, at least one of which is the facial, whose axons come out and take a very prolonged course, some of which will branch off to facial muscles around the eye. So that if one taps around the eye, one can evoke a monosynaptic reflex involving spindles of facial muscles and reflex contraction of facial muscles as an eye blink. How these spindles and the extraocular muscles actually connect with their respective motor neurons is not known, and exactly what their function is not known. But at least there are afferents known with exactly the same kind of connection. So presumably, one could evoke, one could test it, one could evoke segmental monosynaptic reflexes in extraocular muscles. For most of the rest of the head muscles, we don't really know anything about spindle afferents and connections. So any problems about the large fiber system? I should say we also don't know very much about how the spindles from mesencephalic nucleus get into the projective cerebellum. There must be some way of relaying information in, and one of the hypotheses is that there are second-order neurons in this same region that receive secondary collaterals and project back into the cerebellum through the superior cerebellopedal. There are such elements described in embryos, but it seems to be too complicated for the adult and hasn't been worked out as I know of. But otherwise, the head and spinal segments look quite similar. They're both small fiber and large fiber systems. The in-between system is reasonably straightforward for spinal segments, but becomes much more complicated in the brain stem. And so just to summarize briefly where we're going to be going, we'll consider the medium fiber systems, midbrain, anterior, middle, posterior, cervical, and so on. With a typical medium-sized fiber in a spinal segment coming in and entering in posterior columns, giving rise to primary ascending and descending collaterals, secondary collaterals given off at various levels in the posterior column to cells more diffusely arranged in the base of the posterior horn that gives rise to the ventral spinocerebellar tract. Conveying all kinds of in-between types of information up to the cerebellum. The ending, the destination of the caudal main branch is not obvious. But for the rostral branch, going up into the nuclei of the posterior columns, is obvious. Cuneate and gracilis for relay up to thalamus as medial lemniscus. Any problems with this one? When we come to the brain stem, we don't have many of this particular kind of element. Some in the trigeminal, that come in to the main sensory nucleus of the trigeminal. Which is essentially analogous to nuclei of posterior columns and relaying information upstream to the thalamus. Most of the other are more special types of sensory inputs. In the posterior hindbrain, for example, here we have a variety of inputs from heart, lungs, GI tract, that have cell bodies out in the ganglia of this particular segment, jugular, nodos, petrous, whose central fibers branch rostral caudally, as all fibers should do, and end with secondary collaterals to a nucleus that surrounds the tract. And so one has a very peculiar microscopic appearance. Of a nucleus surrounding the tract, so that the myelin sheath staying, the tract stands all by itself, and looks then like a solitary tract. Because it's heavily myelinated and surrounded by gray matter, and the nucleus of the solitary tract. This turns out to be one of the major association systems for posterior hindbrain reflexes related to mouth functions and control of heart, lungs, and GI tract. We'll come back to that in more detail when we talk about posterior hindbrain specifically. Middle hindbrain segment, we have some similar fibers, T-shaped, that come in and join the solitary tract, mostly for taste. But most of the sensory input the middle hindbrain segment has cells that look different from all the ones we've talked about so far. these are going to be bipolar cells. Instead of the unipolar T-shaped elements. And these will come in from the vestibular and cochlear end organs and end upon vestibular cochlear nuclei of the association plate for specifically vestibular and auditory functions. So, we have then the sensory plate made up of discrete ganglia, which are brainstem segments or spinal segments, with a very primitive small cell system, with small cells in peripherally placed dorsal root ganglia for essentially each of the segments, brainstem, spinal, with a fairly simple pattern of ending in Lissauer's tract or descending tract of the trigeminal, ending upon a laminated nucleus below for flexor reflexes or for projection across and up to the phalanx for pain temperature. At the other extreme, we have a large fiber system, well known for deep tendon reflexes, stretch reflexes, and spinal segments, jaw muscles, and periorbital muscles, present and extraocular muscles functioning not quite so obviously, and not well known for other brainstem segments. In between those two extremes of sizes and functions, we have all the rest of the roughly intermediate sized neurons for a variety of other general sensory functions and special functions of taste, hearing, balance, and so on. And to be complete, I should put in the olfactory visual system, that they are parts of the brain and different from sensory plate. It's general distribution, general functions, general connections. And the general pattern of three types. If not, let's take a look at an overview of the motor plate. Brain, anterior, middle, posterior, cervical, so on. Motor plate, you recall, has three parts too. A lateral group, a medial group of large alpha motor neurons, voluntary, going out to extremities or axial muscles, and a dorsal lateral group of autonomic neurons as preganglionics and postganglionics out to glands and smooth muscles. We discussed last week briefly where these were in spinal segments. And the easiest one to see is the medial group. Medial alpha motor neurons, anterior horn cells, that are going to go out and supply neck, chest, abdomen, so on. Medially placed axial musculature. They'll be present in every segment. Every section that you look at in the spinal cord will have this medial group of neurons. The lateral group, on the other hand, will only be present C567 here, T1, and down below L2 to S1, something like that, for the extremities. So that you won't see this lateral group except in those segments. And then the dorsolateral group for spinal segments will only be present in T1 to L1, and then another piece of it in S2, 3, 4, 5. So that you won't see the autonomic preganglionics except in those particular segments. Now when we get up to the brain stem, I cheat a bit. We still have medial lateral and dorsolateral orientation of nuclei. The lateral is not exactly the same. It's not as far lateral as the extremity ones. But we have lateral neurons, laterally placed neurons, in the posterior hindbrain that continue down into the upper cervical segments. As motor neurons for the 9th, 10th, and 11th cranial nerves. And this is where the lateral comes out to be not exactly the same. Let me show you. If we take a section here, say C2, any convenient section, we'll have a nice large posterior horn. We won't have any autonomic. We won't have any lateral. We have a little medial clump of neurons here. And so the medial neurons going out to medial neck muscles are joined by a more laterally placed, but not as far out as one would like, for an extremity. Neurons go out in a very peculiar fashion out here as the 11th cranial nerve, entering just a couple millimeters in front of the dorsal group, and ascending hardly draw it. They come out here and up into through the foramen magnum to join the other fibers of the 10th and 9th and go out to the jugular foramen again. So although I put this column in the lateral It's relatively lateral to the medial group, but not as far lateral as the extremity group that we saw in the lower segments. And it doesn't have the same ventral root X pattern. So it's an oddball. One of the little exceptions that one has to pay attention to. There is, in addition, a medial group, 12th, and a dorsolateral group, of the 9th and 10th autonomic preganglionics. So this segment, posterior hindbrain, is going to have all three of the major components: medial, lateral, and dorsolateral. The medial one, 12th, will come out ventrally, as you sort of expect anterior horn cells to do, but the dorsolateral and lateral ones come out laterally and align with this 11th cranial nerve, which I'll show in the next minute. So any questions about this peculiar pattern of motor neurons in the posterior hindbrain segment? Next segment up has a medial group, 6th, a lateral group, 7th, and a dorsolateral group, autonomic preganglionics, for tears and salivation. So it also has, but much more discretely placed, medial, lateral, and dorsolateral neurons, motor neurons. Middle hindbrain, though, is quite reduced. Has only a lateral cluster of motor neurons for jaw muscles, the motor fifth. Doesn't have any medial group, doesn't have any autonomic group. The midbrain.
So the one that was reduced was the middle hindbrain or the anterior hindbrain?
What did I say? It should be anterior. Middle has everything, the posterior has everything, but the middle is reduced. The anterior is reduced, having the trigeminal only. And the midbrain has the third and fourth has medially placed elements for voluntary motor control of most of the extraocular muscles. The fourth, as you recall, has a very curious course going backwards and around, crossing completely and running this long subarachnoid space around the cisterna ambiens, into cisterna ambiens, around the midbrain, out to the superior oblique. The fibers of the third come straight forward. Some of them are crossed, most of them are not. And then there's a dorsolateral group, anterior Westphal, for light and accommodation reflexes, but there's no lateral group. So it's reduced in number of places where motor neurons exist. So again, the general pattern of motor neurons. 3 major columns: medial, lateral, dorsolateral, but not continuously placed throughout the whole nervous system. Medial neurons in midbrain, middle hindbrain, posterior hindbrain, and all spinal segments. The lateral neurons in anterior, middle, posterior, hindbrain segments, and in the extremity segments of cervical and lumbar. And dorsolateral in midbrain, middle hindbrain, posterior hindbrain, thoracic, and sacral segments. Any questions? I've left out one. I've left out one of the motor neurons. Any volunteers? You may remember that I gave you 2 ways of remembering groups of 3. We've been through the anatomical, topographic, localized version. Medial, lateral, dorsolateral. The other version is more functional. Alpha motor neurons, voluntary, autonomic, involuntary, and the gamma elements. Gamma elements, as far as I know, are located everywhere that we have voluntary muscles and spindles. And they're going to control the small muscle fibers around which the muscle spindle wraps. These small muscle fibers can striate at the ends, and the gamma unit projecting down to those ends. And when the gamma system fires, it's as though these ends contract and the spindle put under tension, so as you get a larger response to the same stimulus. In other words, you have the basis for a hyperactive reflex. And you get a bigger barrage of sensory input coming in, so a monosynaptic connection of the alpha motor neuron going out. And so when the gamma system is active, the alpha system tends to be hyperactive, reflex being evoked. These small elements must be scattered through the motor plate. One would hope that they are more discreetly organized than that. I don't know if anyone's really worked it out. They certainly should be present, related to the spindles of brain stem segments, but just where they are is not obvious, not known. But we do have another in this same functional type. If we were to call these sensory regulators, we have at least one other system that's been well established to control the primary response to hearing. And that is the crossed olivocochlear bundle nerve, which is a funny fellow. Middle hindbrain, out here in the superior olive. We have neurons that send their fibers dorsally and cross and come out the other side to go to end around the cells, the hair cells, that create the first neural impulses in the organ of Corti. And this system, when active, inhibits the primary sensory neuron. It's the system which I can't use anymore because I have artificial ears. I'm lost. And so I no longer have the ability to control the amplitude of what comes in. Anything comes into this damn ears is amplified up to as high a volume as I can tolerate and cannot be dampened by anything I do. Except for an amplifier there, which isn't very useful. But ordinary people with ordinary ears can utilize this reflex in a variety of ways. The cocktail party is the easiest example. Whereas you're talking to a neighbor in ordinary conversation, you're not particularly interested in tuning on someone else a long ways off. By inhibiting what your neighbors saying and allowing the basal frequency of that other person's speech to come through with all the other noise, and you can play with this system. But this is what you're doing. You're using the olivocochlear bundle to inhibit the frequencies that you don't want to hear and allow the basic frequency you do want to hear to come through. It is historically of considerable interest because back in the 1800s, the first up to 1855 anyway, no one knew whether the facial nerve was crossed or not. They could see these fibers crossing. And they knew that a stroke would produce a contralateral facial arm and leg palsy. But this was 40 years before the synapse was discovered. And so to the French of the 1800s, the facial nerve began in the cortex and came down to the brainstem and crossed somehow to get to the opposite face. Where it crossed, how it crossed, was totally unknown. And then in 1855, Millard and Gubner independently presented cases, or had their residents present cases, in which they, quote, proved, close quote, that the facial nerve was ipsilateral. They had hemorrhages in the middle hindbrain segment that produced an ipsilateral facial palsy. Now, of course, that we know about synapses and where the nucleus really was, their evidence isn't quite so good. But up to that point, it was accepted as good evidence that facial nerve at that level is now ipsilateral. It also serves, even today, as an index of suspicion for you who wish to know whether a textbook of neurology is worth buying or not. So you can look in the index under Millard-Gubler's syndrome, and if they don't have the facial nerve involved, you know that they've relied on secondary sources, and so you can throw it away. Don't find it. So, any problems on sensory plate in general, motor plate in general, association plate to a less complete degree? I thought I would finish a little bit early and stop about now with several purposes